In this edition of Health Matters, we'll show you how innovative stem cell treatments are helping people breathe easier, how hidden sugars may be sabotaging the food you eat every day. We'll share the benefits of working one-on-one with a personal trainer, then later, how custom cataract surgery can change your outlook. All this and more coming up on Health Matters.
If you have trouble taking a breath of air, you are not alone. Millions of Americans have emphysema, chronic obstructive pulmonary disease, and other lung disorders. As a matter of fact, the third leading cause of death in America is COPD, and that's why lung transplants are more and more common. But thanks to advancements in medicine, there are now much less invasive options available to those who have breathing problems. And lucky for us, there's a clinic right here in Tampa Bay that offers an alternative to going under the knife. In this episode of Health Matters, we take you to the Lung Institute in Tampa.
We treat patients with severe COPD, emphysema, and other chronic lung disorders here. We do so through a unique regenerative medicine process that takes place right here in our clinic.
Tell us about your treatment process here at the Lung Institute.
We do utilize a very unique and I'd say differentiated process in the treatment process. So we are utilizing the patient's own stem cells as a form of regenerative medicine to help their lung disorders, whatever that may be.
Describe your typical client.
The majority of our patients have suffered with some sort of lung disorder over the course of many years, and some of them may be at the last option. Perhaps their doctor or physician has told them, hey, you may need to start to make some plans for your children and for your family because we may not have any more options for you. So we hope to be that final option for our patients and create, hopefully a path to a better life for them.
How are you changing people's lives?
We're not just changing lives, I believe this clinic is saving lives as well. We have the opportunity to not just change or save the life of the patient, but also their loved ones. These are patients that have families that are very concerned about them, and they may have gone through a very stressful couple of years trying to find the best way to treat their loved one, and we believe that we're providing that for them.
We're really leading the pack in the pulmonary area at really trying to reverse the disease process, which is kind of counter to what the conventional medicine is currently doing, which is essentially symptomatic treatment. Our goal is intended on reversing and actually rejuvenating lung tissue and changing the actual disease process for patients.
What can a patient expect when they come in for treatment?
It's essentially a good procedure for anybody who's moderate to severe disorder with a lot of dysfunction associated with a lot of disability. Those patients get dramatic improvement. They get significant improvement because they're already so debilitated. But it's also for patients that have, early onset or mild degrees of symptoms. They can, try to do the procedures to slow the advancement of their disease so that they're not, getting to the point where they're moderate to severe, where they're, dependent on all kinds of oxygen and accessory treatments. So I've seen patients at each end of the spectrum. If they're symptomatic and they have disease process, we'll evaluate any diagnostic CTs, X-rays, things like that. If they're symptomatic and there's evidence of disease, then they can benefit from the procedure. Most patients have several different diagnoses, COPD, emphysema, pulmonary fibrosis, pulmonary hypertension. These disorders, affect their condition, their overall ability to do the things they want to do. It affects their independence and their quality of life in several areas of what they do, and provides a lot of stress and strain on their family members.
What's the response been from the patients?
Patients are doing excellent. They're great. I've seen patients that have had procedures here. They're able to do everything that they want to do. Patients that couldn't even go to their mailbox once a day to get their mail are out golfing a couple times a week. Patients that wouldn't be able to go to church, now are going to church and singing in church. So patients are doing fabulous. They're giving us great feedback. I follow up with all of our patients post treatment here, and I'm hearing all kinds of great stories about improved independence and reduced dependency on medications, inhalers, and oxygen treatments.
When we bring new patients in here, it's important that they understand they're part of the Lung Institute family. So we have great examples. One in particular, with me, we have a patient from Auburn, Alabama, which is where I went to school at, and she is contacting me every day saying how thankful she is, how happy she is. We're sharing some personal stories as well, and I think that's one example of many that are being created here. Having the chance to treat dozens and dozens, then hundreds and potentially thousands of patients here, we know will touch a lot of their lives, not just from a medical perspective and a health perspective, but hopefully from a personal perspective as well.
To find out if these medical advancements may be an option for you, go to our website and we'll link you to the Lung Institute of Tampa.
Did you know approximately 12 million adults in the U.S. are diagnosed with COPD, and 120,000 die from it each year? An additional 12 million adults in the U.S. are thought to have undiagnosed COPD. The primary cause of COPD is tobacco smoke, but it's now recognized that 10 to 20% of COPD patients have never smoked. COPD is preventable. How? By creating healthier environments, especially for poor and disadvantaged populations, by decreasing risk factors such as tobacco use, unhealthy diet, and physical inactivity, and by teaching young people early about the dangers of smoking and the importance of maintaining a healthy lifestyle. COPD is not curable, but various forms of treatment can help control its symptoms and increase quality of life for those with the illness. Health Matters will be right back.